This is Dr. Sridhar Vennamaneni at Prathima Hospitals in Kukutpalli, Hyderabad. So today I'm just going to have a brief review of the current recommendations from the American Medical Association. There are simple 10 health tips for everybody to keep your health safe and also for preventing hospitalizations and preventing cancers. The first recommendation is something everybody is aware of this. Number one is to exercise at least 30 to 45 minutes every day. Studies clearly show that patients who exercise have a significant reduced risk of heart disease, reduced risk of strokes, risk of cancer goes down, risk of dementia goes down, and also there are significant other health benefits to exercise, including preventing osteoporosis. It's good for your mental health also. So the health benefits of exercise have been documented in numerous studies. So the current recommendations are everybody should do at least 30 to 45 minutes of exercise every day, if possible. At least 5 days a week, if possible. You could do either brisk walk, jogging, treadmill. If possible, if you're young and fit, you can also add at least 2 days of strength training, doing some weights and resistance bands. So the first recommendation is all about exercise. Even if you do small increments, 10 to 15 minutes in the morning, another 10 to 15 minutes in the evening, that still adds to long-term benefits. The second recommendation is about vaccinations. We all know what's been going all around the world in the last 3 years with COVID. And studies clearly show that patients who are vaccinated have a significant reduced risk of hospitalization, reduced risk of pneumonia, reduced risk of death. So that's just one of the recommendations that is recommended all over the world. But in addition to the COVID vaccinations, we also have vaccinations against the seasonal flu. We have vaccinations against pneumonia. We have vaccinations against shingles. All these are infections that can make your life miserable, can make you really sick and be hospitalized with pneumonia and other complications. So against the seasonal flu, there's a vaccine that's available, and it's a once-a-year vaccine that prevents high fever and viral symptoms that we see with the typical flu. Now, in case of pneumonia, bacterial pneumonia, the most common cause of pneumonia is streptococcal pneumonia. And there's a vaccine against pneumonia which has been shown to prevent reduced risk of hospitalizations and contracting the illness. Now, typically we give this vaccine to patients above 65, but younger patients with diabetes, patients with asthma, or patients who are smoking, patients with emphysema, patients with poor immunity, patients with kidney disease, all these patients also could benefit and will benefit from these vaccinations. So we have the flu vaccine as well as the pneumonia vaccine for patients with high risk of infections. And there is also a vaccine to prevent shingles, which is a common viral, it's the chicken pox that we are all exposed to as children gets reactivated as we grow older. And once you cross 50 and older, the risk of shingles is quite high. And so there's a vaccine to prevent that. The third recommendation from the American Medical Association is to go for regular screenings for cancers. And in women all over the world, breast cancer is very common, and cervical cancer. These are two common cancers. And if you're above 40, or if you have a strong family history of breast cancer, ovarian cancer, cervical cancer, you need to get tested. For breast cancer, the simple screening test is a mammogram. It's like an X-ray of the breast. And you could start at 40 years, and you could do every 1 to 2 years. You could continue that until you're 75. Coming to cervical cancer, the screening test for cervical cancer is a pap smear. It's a small smear done by gynecologists in the office, and that's usually recommended for patients who are sexually active, usually starting 18 and above. And the current recommendations are you do it until you're 65. Every 3 years is recommended. And the advantage of this pap smear is it detects early precancerous cells. Just like a mammogram, what does a mammogram detect? It detects early tumors before they spread, and so those can be easily removed. The same way with a pap smear, you can detect early precancerous cells, and once they're removed, your risk of spread is significantly reduced. Other cancers that we see, prostate cancers in men. In men above 40, the risk of prostate cancer increases, and usually the patient ages, the risk increases. So there's a simple blood test called a PSA, prostate specific antigen test, which guides us in detecting cancers. Now the PSA can go up even with infections, but either way, a simple test will you'll have a baseline test. If you're above 40, that's when it's recommended. And typically it's recommended once a year. You start at the age of 40 and then we continue it until you're 70, 75. So that's another test that's recommended. If you have a strong family history of colon cancer or stomach cancers, then you need to be screened for those cancers with there's a stool test and also there's a colonoscopy. The fourth recommendation from the American Medical Association is to be screened for diabetes. Since diabetes and pre-diabetes, these are all mostly, most patients are asymptomatic and patients are not aware that they have this disease. So unless you get tested, a simple blood test called a HbA1c does in the diagnosis. If your HbA1c is above 6.5, we label you as being diabetic. So a simple blood test, even if you do that once a year or every couple of years, it will not be a surprise for you. The next recommendation from the American Medical Association is to be screened for hypertension. The reason for that is blood pressure is a silent killer. Most patients with high BP are not aware that they have high blood pressure. So unless the blood pressure goes up significantly high, a lot of patients are asymptomatic. That high pressure can cause silent changes in your heart, in your blood vessels, in the kidneys, in your brain. So the risk of heart disease, heart attack, heart failure, stroke, all this goes up. The same thing with kidney failure as you age or if your blood pressure is significantly high. So a simple screening, which would be getting a blood pressure check periodically, would detect high blood pressure. The next recommendation is to reduce your stress, because stress clearly shows, all the studies though shows that patients who are stressed, who don't sleep well, have a significant higher risk of all kinds of infections and cancer. So the recommendations are to exercise regularly, sleep at least 7 to 8 hours, eat a balanced, healthy diet, more vegetables, and de-stress as much as possible, which could mean either doing some yoga, doing some meditation, or taking some time off with your family. So things like that, which will reduce your stress, have been shown to prolong life. The next recommendation is to reduce the amount of alcohol intake. All over the world, we know that risk of alcoholism or alcohol intoxication has been going up. So the current recommendations are, if you're a lady, females, your recommendation should be to have not more than 1 drink a day. 1 drink could be a glass of wine or a small beer or 30 ml of scotch or rum. For men, the recommendations are not more than 2 drinks a day. So once you go above 2, then your complications from alcoholism start setting in. So reduce your alcohol intake is the current recommendation. The next recommendation is about diet. Now, we clearly know all over the world as people start making more money, their kids start eating outside, they're eating a lot of fast foods. So the consumption of unhealthy diets has gone up. The same way, consumption of a lot of beverages with added sugar, like your Coke, Sprite, your fruit juices, all these have a lot of sugar added in them and a lot of preservatives, which are not good long term. So the recommendations are to avoid these drinks as much as possible. Increase your fruits and vegetables. So more fruits, at least 3 fruits a day, a lot of vegetables each meal, and also increasing your consumption of nuts and seeds and reducing your meat intake, because studies clearly show that as you increase your intake of meats, red meats or all kinds of fried food, there's more inflammation, there's more, the cholesterol goes up, triglycerides goes up, risk of heart disease goes up, risk of stroke, cancers, dementia, everything goes up. So recommendations are, try to reduce your meat intake, try to get more plant-based protein, more fruits, nuts, egg whites, stuff like that. The last recommendation is about avoiding antibiotic use unnecessarily. We clearly know a lot of patients come to us requesting antibiotics for fever. Even for viral fevers, we see patients asking for antibiotics on the very first day. And clearly, resistance to antibiotics has been going up all over the world, and it's been difficult to treat a lot of hospitalized patients. And sometimes we are forced to use expensive antibiotics, IV antibiotics, because of this resistance. And even for simple infections, urine infections, we're seeing a lot of resistance. And the main reason for this is indiscriminate use of antibiotics. Before you use any antibiotics, please speak to your physician And for simple colds and coughs or viral infections, antibiotics have no role, and that will only increase your risk of resistance, increase your risk of side effects. And when you need antibiotics, you'll need another course and with more side effects. So please avoid antibiotics. Thank you.